Hi, my name is Alyssa Fisher, and the topic I have chosen is chronic anxiety and depression among adolescents and the health concerns that come along with that. Um, the prevalence of depression has increased over the years among adolescents. Depression can be caused by traumatic events that the children have experienced or other things such as this COVID-19 pandemic that we've been experiencing. Um, Usually, when you have depression, you have anxiety as well, and that is very common. Here in Utah, in the year 2020, from the ages of 12 to 17, 15.48% of children suffer from a major depressive episode, and nationally it is lower at 13.01%. And the reason that Utah can be higher in percentage is because of the decreased access to providers that we have here in Utah. Some of the contributing factors and social determinants of health are it could be friends, it could be excessive bullying at school, the child might have disability, poverty, it could be a school that performs poorly, and literacy. Some other contributing factors that are physical, psychosocial, and economic could be family history, obesity, peer problems, bullying, trauma, anxiety, sexual abuse. And then the root cause. So there's not really a single root cause of depression, and there are many contributing factors. They say that abnormal brain activity is an accepted explanation, and that is just the imbalance in chemicals such as serotonin that could contribute to the depression. Of needs that are met could be the physiological, and unmet could be the love and belonging and safety and esteem. The anticipated functional level could be fatigue, have difficulty concentrating, and be irritable. And health outcomes could be weight changes, chronic pain, suicide, and then, of course, a weakened immune system. Some concerns with communicable diseases or infection. Since the immune system has been weakened, many of the children that are suffering from depression get diseases, infections easily because of changes in appetite or their sleep patterns or stress. For an example, influenza, your body is just struggling to fight that off, and so that's one of the examples of an infection disease. Also, managing and treating the depression are antidepressants, exercise that helps with stress and your sleep patterns, therapy, counseling is also another way to manage. And then non-communicable diseases could be heart disease, high blood pressure, maybe you're stressed out, inflammation, you can't fight off infection, and chronic pain. And ways to manage that would be through medications to treat the high blood pressure, antibiotics to treat infection, exercise, and then a healthy diet. Some other concerns of self-care or self-harm. Suicide is a major issue with children that are depressed. Also, a lot of children that do self-harm, such as cutting, burning, drug overdoses. And ways to mitigate that harm is through like behavior modification, going to therapy, getting counseling, and also medication. And last, other risks for harm by others, victims of sexual abuse. So a lot of perpetrators, they go for the children that don't have a lot of self-esteem or self-confidence, and then they become victims. The perpetrator makes them feel like they're loved and important, so they continue to go back to the perpetrator. But those are some other ways that they're at risk for harm. And then these are my references, and thanks for watching.